The Guam and Hawaii National Guard participated in a virtual subject matter expert exchange with the Plans and Programming Division of the Armed Forces of the Philippines in the first days of December. The National Guard State Partnership Program facilitated this SMEE. Normally, during a tabletop planning scenario in a SMEE, the planners are presented with a theoretical or historical scenario in order to build a response. However, over the 3-day virtual engagement, the medical planning team from each participating entity presented their real-world COVID-19 response actions to date and plans for future actions.
It's a medical SME and it's also a operational SME, looking at the COVID-19 response for the military, but also looking at how we've integrated our interactions with the civilian sector. Hawaii will be looking at what it's been doing with the Department of Health, namely our work to try and help flatten the curve, specifically how we've worked COVID-19 tracing team, and then also what we've been doing with Task Force Med was kind of unique. From Guam, they're going to show how they've been able to support their efforts to support the government, and the Philippines have a mass array of efforts they've been showing and sharing over the last 3 days.
During a normal SME, the scenario being discussed and analyzed is completed, but the COVID-19 pandemic is not over. Therefore, part of the discussions focused on the future distribution of a vaccine. There have been mass testing and dry flu vaccination events in the COVID response. These efforts in the Philippines, Guam, and Hawaii were examined by the medical planners as examples to create the future vaccine distribution plans. This is Master Sergeant Andrew Lee Jackson reporting with the Hawaii National Guard.